Hello, everyone, and welcome to another exciting session about uh, the im- deployment and maintenance of ChatGPT in the field of healthcare. So, this will be the layout of our talk in this session. So, let's go. Um, as we all understand, it's not only important to deploy such artificial intelligence tools, but also to maintain these tools as well. And we all will agree that healthcare is a rapidly evolving field with any uh, lot of developments which is happening on a regular basis. And these chatbots powered by artificial intelligence have emerged as a promising solution to some of these challenges, particularly when it comes to improving patient engagement and satisfaction. However, deploying and maintaining chatbots in a healthcare setting can be complex and challenging. We will try to explore in this session the key considerations which are involved in deploying and maintaining the chatbot in a healthcare environment. We'll start looking at how ChatGPT can be integrated with existing healthcare system as EMR and telenet platforms. We will then discuss how user support and escalation processes can be handled effectively. Next, we'll dive into the nitty gritty of deploying and maintaining ChatGPT in healthcare, providing practical advice and tips for implementation. Finally, we will cover continuous monitoring and maintenance of chatbot performance. By the end of this presentation, you will have a comprehensive understanding of what it takes to deploy and maintain ChatGPT in a healthcare setting. So, integrating ChatGPT with the existing healthcare system is indeed a very crucial step to ensure seamless communication between patient and healthcare providers. And through this, the patient information can be accessed and to provide personalized care to patients. Similarly, by integrating ChatGPT with telehealth platforms, patients can easily connect with their healthcare providers from the comfort of their homes. However, integration with existing healthcare systems can be complex and time consuming. It requires a thorough understanding of the systems involved and careful planning to ensure the integration is successful. It is important to work closely with the IT teams and other stakeholders to ensure that the integration is seamless and meets the end of both patients and healthcare providers. In order to ensure users have the best possible experience with ChatGPT in healthcare settings, it is important to have a robust escalation process along with a user support. It includes having a dedicated team of support staff which are available to answer the user questions and provide assistance when needed. It is also important to have clear escalation procedures in place for more complex issues that cannot be resolved by the support team. This may involve escalating the issue to a higher level of technical support or involving other stakeholders such as healthcare providers or IT professionals. Deploying ChatGPT in healthcare requires careful planning and execution. The first step is to identify the specific type case for the chatbot, whether it is triage, patient education, or something else entirely. Once the use case has been determined, the next step is to gather and prepare the data that will be used to train the AI model. This includes medical records, clinical guidelines, and other relevant information. After the data has been collected and prepared, the AI model can be trained using machine learning techniques. This process can take several weeks or even months, depending on the complexity of the use case and the amount of data available. Once the model has been trained, it can be integrated into healthcare system using APIs or other integration tools. Finally, it is important to test the chatbot extensively before deploying it to ensure that it performs as expected and it meets all the necessary regulatory requirements. Maintaining uh, artificial intelligence models like uh, this chatbot requires a proactive support to ensure that the chatbot is always functioning at the optimal levels. Therefore, regular performance monitoring, updates, and testing are important to keep up with the evolving needs of the healthcare industry. Additionally, it is important to have a dedicated team responsible for maintaining ChatGPT to ensure any issues are addressed promptly and efficiently. Best practices for maintaining such bots, including conducting regular use feedback surveys, analyzing chat logs to identify common issues, and providing continuous training to support staff. Troubleshooting tips may include identifying potential bottlenecks in the system, reviewing error logs, and working with technical support to resolve any issues that may arise. As with any technology, continuous monitoring and maintenance are very critical to ensure a good performance. In addition, ongoing testing and evaluation are necessary to identify and address any issues that may arise. To achieve this, it is important to establish a clear process for monitoring and maintaining the chat GPT. This should include regular check ins with users to gather feedback and identify areas for improvement, as well as a system for tracking and addressing any technical issues that may arise. By staying on top of these tasks, one can ensure that such platforms continue to provide value to the patients and healthcare providers alike. To conclude, not only deployment of such chat uh, GPT or chatbots is important, but also maintaining is crucial to the improvement for the needs of patient outcomes and enhancing the overall healthcare experience. In fact, platforms such as ChatGPT can provide personalized and efficient care to the patients as we continue to innovate and advance in the healthcare industry. It is important to embrace new technologies like this one, which may revolutionize the way in which we approach patient care. Let's work together to make the healthcare more accessible, efficient, and effective for everyone. Again, I would like to